Is that click you feel in your knee a meniscal tear? Let's find out. Hello, I'm Professor Manish Kiran. I'm a consultant orthopedic surgeon with a specialist interest in your bone and joint health. To understand the problems that are caused due to a meniscal tear, we first need to understand what a meniscus does. Menisci are two C-shaped structures that are present within the knee joint. They help increase the area of contact between the bottom end of the thigh bone and the upper end of the shin bone. They work as shock absorbers. They improve stability, and they also protect the knee joint from wear and tear. A meniscus tear can occur in two ways. It can be traumatic following a twisting injury. This may be while playing a sport or while getting out of bed. The second possibility is a degenerative meniscal tear, where the tear isn't present in addition to arthritis that's present in the joint. You can have a sudden sharp pain that can be present for longer periods of time, a sense of giving way and instability in the knee, occasional swelling in the knee. The other symptoms that we see with a meniscal tear are a sense of locking or catching. Occasionally the knee can be locked in a position and it may not move one way or the other. You might also have some pain along the joint lines. And patients might feel clicks when they move their knee, and the pain can be brought on particularly when they are trying to squat or go up and down stairs. The diagnosis of a meniscus tear is done by a combination of clinical examination with specialist tests and imaging. MRI is done, and it's the gold standard to confirm the presence of a meniscus tear. Is an MRI always necessary in the context of a meniscus tear? Yes and no. The MRI helps us to get an idea about the condition of the meniscus and also shows us if there's a tear. It also shows us the condition of the rest of the knee. A large proportion of patients above the age of 50 who've got arthritis in their knee will also have a meniscus tear, and this is called a degenerative meniscus tear. They may have no symptoms from the tear, and therefore the findings should be interpreted in the context of the physical examination and the symptoms that the patient has. Can a meniscus tear heal on its own? The simple answer is sometimes. It depends on the age of the patient, the type of meniscus tear, the area of the meniscus that is torn, and the presence or absence of other injuries in the knee. We understand that the blood supply to the outer aspect of the meniscus is very good, and therefore tears in this zone of the meniscus have a tendency to heal. Tears in the inner third of the meniscus have zero blood supply and therefore are less likely to heal. Tears that are present in the middle third of the meniscus have a 50-50 chance of healing. My MRI scan shows a meniscus tear. Do I need surgery, doctor? This is one of the most common questions that I'm asked. Meniscus tears can be managed with non-surgical management like physiotherapy, adequate analgesia, and activity modification if the symptoms are mild and manageable. If there's no locking or catching in the joint, there's no mechanical symptoms, and the patient is able to get on with their activities of daily living. Meniscus surgery may be appropriate if it's traumatic in nature, if the tear is in a zone of the meniscus where there's adequate blood supply, or if all the conservative measures have failed. What are the different types of meniscus surgery? Broadly speaking, there are two types of surgery. One is preservation of the meniscus called the meniscal repair, and the other type is meniscectomy, where the damaged meniscus is removed. With meniscal repair, the rehabilitation is longer. Patients might need to be in a brace and may not be allowed to weight bear on the leg depending on the type of tear and the type of repair. But in the long term, if the meniscus heals, it is for the best. The other type of surgery is meniscectomy, where the damaged part of the meniscus is removed. It is usually present in a zone of the meniscus where the blood supply is inadequate or compromised. And the recovery after a meniscectomy is a lot quicker than meniscal repair, but in the long term, we know that it does lead to osteoarthritis of the knee. How long does recovery take after meniscal management? Well, if you're treating a meniscus tear with conservative management or non-surgical management, it can be between 3 to 4 months. If you do a meniscectomy, then it's usually between 2 to 6 weeks. And if you do a meniscal repair, then the rehabilitation procedure is a bit protracted to almost 3 to 6 months. But if the meniscus heals, then that would be the best thing that could happen to the patient. Can I walk with a torn meniscus? Yes, in most instances. If you're able to manage the pain and you don't feel a sense of instability in the knee, there is no locking or catching in the knee, then by all means, patients can walk on torn meniscus. However, if there is locking of the knee or a sense of instability, then you might need to seek specialist evaluation by your surgeon. Will a meniscus tear cause arthritis? Potentially yes. The meniscus has a very important role in the knee, and therefore A tear in the meniscus makes it defunctioned. This can result in abnormal contact stresses between the bottom part of your thigh bone cartilage and the upper part of your shin bone cartilage. This may result in arthritis. Therefore, in patients who have had meniscectomy, the risk of arthritis is higher than in patients who have had a meniscal repair that has healed. My MRI says that I've got a degenerative meniscal tear. Do I need a meniscectomy? Absolutely not. So back in the day, we used to do a lot of arthroscopic knee surgery for patients who had meniscal tears in the context of knee arthritis. There is very good evidence now to suggest that it is no better than sham surgery. The British Association of Knee Surgeons and the European counterpart have come out with guidelines that in the context of arthritis, in the presence of degenerative meniscal tears, arthroscopic surgery should not be offered. If you've had a twisting injury, a traumatic injury, following which you're unable to fully straighten or bend your knee, there's a possibility that you might have a bucket handle meniscal tear, which has resulted in locking of the knee joint. This would need to undergo arthroscopic surgery, where we can potentially repair the meniscus. Please like, share, and subscribe to my channel, and hit the bell icon so that other patients like yourselves who are trying to find answers to their questions are shown this educational video and it can be helpful to them. Thank you.